Did you know that certain populations are more vulnerable to substance use issues? Understanding the unique challenges is critical. In Zambia, special populations face significant substance-related harms. Today, we will explore how trauma-informed, culturally safe, and anti-racist frameworks can enhance their care. Special populations include adolescents, pregnant individuals, older adults, indigenous groups, LGBTQIA+ communities, and refugees. Each group faces distinct challenges rooted in their social contexts. We must adapt our approaches to meet their diverse needs effectively. Let's break this down step by step. First, consider adolescence. Adolescence is a vulnerable time. Peer pressure and brain development can lead to substance use. Research shows that, in Zambia, teens facing socioeconomic hardships often engage in risky behaviors. Next, think about pregnant and parenting individuals. Substance use can harm both the mother and child. Stigmas around using substances during pregnancy lead to isolation. An integrated approach using maternal health services can support these individuals effectively. Now, focus on older adults. Loneliness and chronic pain often lead to substance misuse. However, these issues may go unnoticed because symptoms are viewed as normal aging. Training healthcare workers to identify these problems is vital for delivering appropriate care. When it comes to indigenous groups, historical trauma plays a role. Traditional healing practices must be respected. Collaborating with community leaders ensures that care is culturally relevant and effective. LGBTQIA+ communities face unique challenges, including discrimination and stigma. Creating safe spaces for these individuals is crucial. Healthcare providers must be trained in inclusive practices, ensuring that everyone receives equitable care. Rural and urban differences affect substance use patterns significantly. Urban areas might face stimulant abuse, while rural areas may struggle with alcohol misuse. Tailored outreach efforts are needed to bridge these gaps in access and resources. Lastly, refugees experience high levels of trauma. Displacement often leads to increased substance use. It's essential to integrate psychosocial support in their healthcare to address underlying needs and promote healing. Now, let's explore how to implement trauma-informed practice. This approach focuses on creating a safe and empowering environment. Training staff to recognize trauma's impact is essential. Clear referral pathways also help those necessitating additional support. Cultural safety goes beyond basic competence. It requires acknowledging power imbalances and historical injustices. County designing interventions with communities respects the cultural practices while integrating evidence-based care. Anti-racist frameworks are vital in addressing inequities in health services. They challenge systemic discrimination faced by marginalized groups. Workforce training on anti-discrimination practices ensures equitable resource allocation. To implement these frameworks effectively, integrated, person-centered care is essential. Services must be designed to address comprehensive needs. Collaborating with various sectors ensures holistic support tailored to each individual's context. Community engagement is crucial for fostering trust. Involving affected communities in the design and delivery of services enhances relevance. Building partnerships with community organizations can promote preventative strategies and increase access. Decentralization allows for innovative service models. Telehealth and mobile clinics can reach rural populations effectively. These approaches extend care while considering barriers like limited connectivity. Legal and policy reforms are necessary to reduce punitive measures associated with substance use. Emphasizing health-centered approaches strengthens community trust in health services. Finally, ongoing research is critical to adapting interventions. Regular monitoring and evaluation ensure that services remain responsive to changing needs. This involves capturing data relevant to various demographic factors. In summary, addressing substance use among special populations in Zambia requires a multifaceted approach. Integrating trauma-informed, culturally safe, and anti-racist practices is vital for effective care. Each group's unique needs must guide interventions. Take action today. Support initiatives focused on integrating these frameworks in your community. Advocate for equitable resources and engage in discussions. Together, we can promote healthier futures for vulnerable populations.